Hey guys, you're watching the Best Practices Show, where we take a look at the best business practices from the best dental practices all over the world. And this is a crazy special week for us. We are out at the Seattle Study Club Symposium here in Palm Springs, California for the 25th anniversary, and it is spectacular. If you've never been, you have to go. It's the world's greatest clinicians and the greatest CE experience in one place, and I've got two amazing clinicians and experts that you do not want to miss. So do me a favor, hit the share button. We'll see you in a few seconds. Hey guys, welcome back to the Best Practices Show. We are having so much fun. We are out here for the 25th anniversary of the Seattle Study Club Symposium. Some of the best speakers in education in the world, and you're going to see these two guys, no exception here. I just feel blessed to be, have the opportunity to learn from these guys. And a couple show notes. We are shooting this live on Facebook. So as you're watching, if you have a question, add it to the feed, and I've got it right here. So give us a good question, and I'll dish it to the experts, and we'll get it straight from the experts while they're on the show. And so a couple things about what's happening this week. As we get together, we get to see some of the best information, education, things that really help us think outside of the box. And so I want you guys to introduce yourselves, because you guys have all been on the show before. But if somebody's watching this, because we do have a lot of dental students watching, who are you? Where are you from? And tell us about yourselves.
Go ahead. Me first?
Yes.
All right. My name's Kyle Stanley. I practice in Beverly Hills, California. I practice the surgical and the restorative side of dentistry. I was trained in Brazil, so I have a close contact with Christian. And I've been involved with DSD for a while, and Christian's been nice enough to bring me on as a KOL, and we work together oftentimes now. And now I'm really focusing on something called the Orofacial Club, which we're talking about, and I try to do full facial aesthetics.
Yeah, awesome.
And I'm Christian, from São Paulo, Brazil, and developer of the DSD concept, and dentist, technician, and now also involved with all these things that Kyle mentioned, trying to go beyond teeth and gum and taking care of the patient as a whole.
Yeah. I look at you guys as the great influencers. You guys are the next generation of influencers that are coming on the scene. Christian, you've been doing DSD. I would love for you to describe what the DSD movement is, and you also have your own club. And then Kyle, you did a spectacular job yesterday just helping all of us think outside of the box. But let's go to where dentistry is headed and why you're so passionate about what the two of you do. I'd love to know more about that.
I think we were talking about this yesterday, about how competitive the market is right now, and the need for differentiation. Mm-hmm. You need to stand out. You need to be different. You need to think outside the box. The world is changing. Dental world is changing. Corporate world is changing. Competition is changing. Human behavior is changing. And I think people, consumers, of course, they want to look good. But they want to have harmony between all the factors. So definitely, I believe that dental offices will become orofacial clinics. Mm-hmm. So first, from the oral environment, we're going to go for the face. So we need to become facial experts. We need to improve our relationship with plastic surgeons. We need to learn from them. They need to learn from us. We need to know everything we can do with the face to improve harmony on that matter. So I think there's a new market for that. There's a new need for information, and it's a beautiful thing because it's a empty canvas. It's like a new area where you're not going to learn from others. You're going to create the solutions. We need to develop the protocols. Mm-hmm. We need to understand what is possible. And that's why I believe that for younger dentists, this is a beautiful moment.
Yeah.
Clinically exciting, emotionally beautiful because patients, they really enjoy that much more, and financially very interesting.
Yeah. Now talk about the beautiful moment, because before we went live, this is one thing I absolutely love. It. You're very, very passionate about the younger generation of dentists coming in, because there's a lot of information. They may are a little bit confused. They feel a little bit overwhelmed. You know, you're newer into your career. So tell us about that beautiful moment, because that beautiful moment put in a room with the two of you and other people that might be mentors might send them on a trajectory that's a wonderful career in dentistry. But that's a very important topic in dentistry.
Yeah, I think that when you're finishing dental school, you're just outside dental school. You're kind of lost, right?
Mm-hmm. You don't know what you don't know. I think.
Yeah. And of course, people say, no, you need to find a mentor, but it's hard. You know, you have a lot of debt. You need to create a strategy. You need to make some money. It would be great if you could leave dental school and not have any financial issues and just be able to go 5 years, work for free and learn, you know. So you need to balance being under a mentor, making some kind of money, and already immediately understanding what is your strategy. What do you want? Where do you want to be in 5 years? You know? I think that's one of the things that is making Kyle grow so fast. He was just driven since the beginning, you know. In dental school, he already had a vision. He had a plan. He can maybe tell this better, but I believe that he had a clear vision where he wanted to be today, you know.
Yeah.
How many years graduated already?
8. Yeah.
So that's a good 8 years. 8 years ago.
Yeah.
Let's see, do you remember exactly where do you want it to be today?
Yeah, I mean, it's evolved a little bit. I knew I wanted to be a speaker as well as a clinician, a wet-fingered dentist, but I didn't realize how much speaking would be a part of what I was doing. Mm-hmm. But I definitely had the vision of understanding the face a little bit better.
Yeah.
And I talk about it in my lecture. I talked about it yesterday. When I was in dental school, I was looking at the face and understanding the face because I thought I wanted to be an oral surgeon. Mm-hmm. So I was looking at it kind of from an orthodontic standpoint, and then I met my first mentor, Pascal Magnier, and I started getting into aesthetics. And so I had this vision of the face, but now I was learning about dental
Working with the
aesthetics
teeth,
for the first time.
Right.
So I kind of went backwards to where now, you know, it's taken, like...
It's interesting because if you, saying what you're saying, if you come from the face, pretending that you wanted to be a professional that takes care of the face, and suddenly you're trapped into only dealing with teeth.
Yeah.
That's when you probably realize the limitations.
Exactly. No, that was it. And I talk about it in my lectures. Like, we're always taught to start a full mouth rehabilitation or implants or dentures based on wherever the lip is. But we never specified if the lip was in the correct position.
Right.
You were just supposed to accept it.
Mm-hmm.
So when we started to talk, and I learned that Kyle was working with the lip, and for me the lip was always the missing link, you know. And that slide that we always show on the lectures, you know, you have all the little pieces of the face that you can move. If you have a top team, let's pretend you have an amazing dentist, rehabilitator, you have an amazing dermatologist, you have an amazing plastic surgeon, you have an amazing orthodontic surgeon, amazing periodontist. So you have this team that can do everything that is possible out there. Now, you can change people's nose, you can change people's eyes, you can put Botox, you can change eyebrows, you can do graftings here, you can change the contour of the face, you can do orthodontic, move the bone, move the jaw forward, backwards, up and down, and then you jump into the mouth, and dentists can move the teeth up and down, forward, backwards. We can move the gum up and down. Right. We can move the incisal edge up and down. And you probably noticed I didn't mention the lip.
Yeah.
So the lip was lost in space.
Well, and we're going to get back to that, but what's really cool about what you said is you can do all of that before touching the patient, and that's what the movement you're so passionate about is digitally. We can see where this is going to go before doing anything invasive.
I think that the more comprehensive you go, the more complex you go. the more risky it is.
Right.
You know, you tell your patient that you're going to do a simple composite, it's easy because if you do a little mistake, you fix, you redo. Now, if you're going to try to convince your patient that you're going to cut them in pieces and do like a 12-hour surgery that they will take 3 months to recover, if things go wrong, that's a problem. Right?
Yeah.
So as we become better interdisciplinary planners, as we plan more complex treatments, we want to use technology to try in the computer before we mess up in the mouth.
Yeah.
So as I joke sometimes, we want to kill the patient on the computer virtually before we kill them for real, right? So that's where technology comes. I'm not talking about technology helping us to perform. That's also amazing from technology, but technology helping us to see the solutions, simulate the solutions, compare the solutions, and make final decisions, and then present the solutions virtually in 3D to the patient, so the patient can see themselves before committing. So they can see the face, they can see how things will look, they can see the options. So I think technology will play a big role, allowing patients to feel more comfortable accepting these more complex treatments. Yeah.
Absolutely. And Kyle, you're a busy man. This particular symposium, you did a fabulous job yesterday. It was spectacular, and I was so proud. I was like, yes.
I'm back cheering.
Absolutely. We only get you for a couple more minutes because I know you have to run, but I want you to describe what the lip factor is, and basically the essence of what you talked about. And then you guys are so passionate about it, the club, that you're committed in helping other young dentists learn and just at least have the right mindset when this comes together.
Yeah, so the lip factor, I actually kind of started thinking about it in dental school, what we were just talking about. I was studying my own face and realizing and reading articles, and when everyone else was reading dental articles, I was reading plastic surgery articles and psychology articles on the study of beauty, and really tried to understand why we're attracted to somebody or why we're not attracted to somebody. And what I learned is that there was this big missing link, like we talk about, and that was the lip. So what it is now in the lip factor idea is not accepting the upper lip wherever it is. We can move it up, we can move it down. And with our specific technique is we can move the lip up, because oftentimes patients age and their lip droops, so their lip gets longer. And we're told in dental school and in every treatment planning seminar to just accept that length and lengthen the teeth if you want to make the patient look younger.
Right.
Which changes the facial thirds and makes the patient just look unnatural. It doesn't make them look younger.
Right.
So I found this plastic surgery procedure that had been around for decades, but nobody was using it because it left a scar under the nose. So I started trying to find people that were using this or modifying this, and I found Dr. Ben Talay in Beverly Hills, and we've worked really closely together the last few years, and he's been able to modify this technique to make it very predictable. It's an easy procedure that's done 45 minutes under local anesthesia, patient's awake, and now we can bring the lip back to the correct position, and then we can plan traditionally how we were taught.
Right.
So we can get full facial aesthetics just by correcting one thing and totally plan the smile in a correct position based on the face.
Absolutely. Now this is so far, I could see as you were speaking yesterday, it's pretty far outside of the traditional box of restorative dentistry. And as a young dentist, I guess what's so important when I look at you guys, a young dentist might be watching this and feel overwhelmed. And that's why the mentoring process, you had a very unique journey. You found great mentors early, but finding these kids and these dentists that are younger, helping them understand this whole process. Tell us about that journey in your study club, what you do.
I think as a young dentist, the first you have to ask yourself, and there's no right and wrong here. You just need to ask yourself, do I want to just be a normal dentist and have a great life being a normal dentist, or do I have the ambition and the energy to become something that is new, that is beyond the average? If you have this energy and this ambition, I'm sure there are many mentors out there looking to help these kind of students. So of course nowadays it's very easy. I have people reaching out to us through DSD, through our social media channels every week. Young people, how can I get involved? How can I give the first step?
Right.
And there's many ways we can help. So just connect with us through social media, and if you want to become this superstar orofacial expert, we can help you.
Yeah. Now, this is an important point, and I love the fact that you're here, though. And so many young dentists say, I need a mentor. Well, mentors don't find you. You have to find mentors. Would you agree with that?
Yeah, so I had this early because I found Pascal Magnier, and I was like, I want to do what he's doing.
Right.
Basically, I just said, can I hold on to your shirt for the next few years, So every time he was working on a patient, I was like this. Anytime he was doing research, I was like this. And it was the same thing with Christian. When I met Christian, I just kind of wanted to stay as close as I could with him.
Right.
But I think as a mentee, you have to offer something as well.
Right.
So whether it's helping with research, or, hey, can I help you take photos, or can I retract, or anything that you can do to help that mentor, because oftentimes these are the big guys. They're busy, they've got stuff to do, and there's a lot of people that want to be around them. So you have to kind of come with something, but that could even be your passion.
Right.
Even if you just show, I'm so passionate about this. What time do you need me there? 6 a.m.? I'm there. 5 a.m.? Whatever you want, you know? And I put in that time early, and it was the same. I had 3 mentors: Pascal Magnier, Sasha Jovanovic, and Christian.
Yeah.
And you have to put in the time too, so that they see the potential in you. Because it happens that, I've even started mentoring recently now too, and I get proud when I see the people that I've shown some things. So I think it creates the legacy. And that's the whole thing about this tour is the legacy tour. So
it is, and it's a special one.
And if we may, shifting a little bit from the young dentists and leaving a message to the established ones, dentists and plastic surgeons, we want to invite you all to this new journey, the orofacial club journey, going beyond the smile, closing this gap in between plastic surgery and dentistry. For some reason, there's still today almost no connection whatsoever, and that makes no sense. If you talk to a non-dentist, probably if I tell you, a super clever person, and I say that the experts that are taking care of this don't have a clue about what we do over here, and we don't have a clue about what they can do there.
Right.
And the problem is that all these tissues are connected, and there's so much we can do more. So I think it's an obligation for us to go after these new solutions and to offer new solutions. So I think that this course that we are giving, this year we're going to give this series of orofacial club courses with the lip lift is the, let's say, it's the hook, because it's a cool, simple little technique that people say, I want to learn. But in these courses, we're going to go much deeper inside. We're going to express our new way of analyzing faces,
new philosophy,
treatment planning the cases based on the face. Of course, we learn treatment planning from great mentors above us, but we are bringing a new flavor when it comes to looking at the face from the dynamic perspective, from the organic perspective, understanding that we can move better all these pieces. We have amazing professionals in Brazil working with perioral procedures, and one of the top, maybe the best guy in Brazil is involved and will be on the course, Altamiro Flávio. So we're going to go from facial analysis, perioral procedures, orthodontic surgery with Octavio Sintra, one of the top guys in orthodontic in Brazil, also on the course, orthodontics, orthopedics, orthodontic, perioral, plastic surgery, and smile design.
Connecting it all. And like you said, it may sound crazy for a lot of people because it's taken 20 years for dentists to work with other dental specialists.
Right.
Just to have a periodontist or an oral surgeon talk to a prosthodontist or a general dentist has taken 20 years. So now, when we're saying now we need to go outside of our little dental specialty into other categories of medicine, when you get a plastic surgeon that understands this, they're like, oh yeah, this makes total sense, because I don't know anything about the teeth, you don't know anything about plastic surgery. Now if we work together, our results can go so much higher by incorporating each other. And that's the whole idea.
The future will be collaboration in communities like this that make it better. And you have 3 full decades, maybe 4 in front of you. And as you can see, he's got a spark in his eye.
Yes.
And when that spark is there, you're like, this guy, he's got a great career ahead of him. So how do people find out, if a young dentist or a mature dentist, where do I find what you guys are doing?
DigitalSmileDesign.com.
Okay.
You go education, lip lift course. You have all the information there. Mm-hmm. You can send any question either through you here or through info@digitalsmiledesign.com.
Okay.
You just send an email asking for more questions. In the website, we have a very good PDF explaining the whole course with details. Of course, you can send private messages to me or to Kyle on I usually say if you send an email, it takes usually a month to reply. Mm-hmm. If you send a message on Facebook, it takes a week to reply. And if you send a message on Instagram, it usually takes a day to reply.
Yeah.
So Chris Coachman on Instagram and
Dr. Kyle Stanley, Dr. Kyle Stanley on Instagram.
Awesome. Don't even think about it. Follow them now. These guys, you're going to see a lot more from them, not only on here, but elsewhere in the world. If you get a chance, you got to go. So thank you, gentlemen, very much. I know you have to run for a little bit. Christian, you and I are going to cover some other topics, but thank you guys for tuning in today on the Best Practice Show. Again, we're out at the Seattle Study Club Symposium. You got to come to this thing because you get surrounded by people like this all day long, and it is just the greatest blessing and the greatest profession. So thank you, gentlemen, for being here.
Thanks.
Really appreciate you. And thank you guys for watching. If you enjoyed today, do us a huge favor. Just hit the share button and keep watching the Best Practice Show. We'll see you guys soon.